So you may be wondering why you're having stiffness from sitting at an office job all day. So this is actually very common. We see this with, well, I'll say this. Most of our people who come in with neck and shoulder tightness either excessively use their shoulders and neck muscles from lifting or carrying things like in a factory, or they sit at a desk at a computer all day. And that's probably the most common one, to be honest with you. I'm Cameron. I'm a doctor of physical therapy, back on track therapy and wellness in Lima, Ohio. So let's get into this a little bit. So the reason that you're having the stiffness is because your body likes movement. It likes for you to change positions throughout the day. It likes for you to activate different muscles. So when you're sitting for long periods of time, you have your trapezius muscles here, and then you also have other deep neck extensors here that are highly active, not to mention the muscles between your shoulder blades. They're highly active throughout the day. And if you're doing that, and if you're in the same position a lot of the times, it's setting you up to have stiffness. There's lack of rest for those muscles. And so essentially, they're getting tired. While it may seem obvious, the solution a lot of times isn't something that people are doing. And so the trick is to find different positions that you can get into throughout the day. So if you're currently sitting in this sort of slouched over position like this for a lot of the time of the day, it might be a good idea to throughout the day come up like this, but that's not it. Okay. Because if you sat like this all day long, guess what? There's still muscles back there that are going to be active throughout the day, right? And so that's not necessarily the answer is to have perfect posture because really there's no evidence that there is a perfect posture, despite what you might hear from a lot of other people online. Um, there is no proof that there is a perfect posture. So trying to maintain this perfect posture isn't going to necessarily set you up to have no pain. So what I suggest is, for maybe a little while you're here, sometimes maybe you slouch back a little bit. But the key to me is trying to move your shoulders like this. Okay. So when we go up like this, we're activating these big trapezius muscles, these big neck muscles, which attach up into here. Okay. They're big muscles, some of the biggest muscles that we have actually. When you're coming around doing the shoulder circles, you can see how it squeezes my shoulder blades back like this. That's activating the middle and lower trapezius muscles and the rhomboids. So those are other muscles that help bring your shoulder blades back. They're a lot of times in a stretched position and being held like that. So they're active, they're tired. It's almost like if you held your bicep, if you held your elbow in this position all day long and you had a weight here and you didn't give it a chance to rest, this muscle would get tired. So it would start to cramp up, which you might notice in your shoulders and neck sometimes, or even in the muscles behind you. It might feel stiff. It might feel like it's burning all of the time. But just understand that there's different types of symptoms, but a lot of the times the cause is just that prolonged position without moving. So by just doing shoulder circles, that's very helpful. Moving your neck side to side like this, stretch, get a little bit of stretching, but also it activates these muscles so there's increased blood flow up and down. These things should feel good to you, by the way. If they don't, what I suggest is maybe don't go as far. So if it hurts to look up, just don't look up as far. If it hurts to go one direction, just don't go as far. Try to go into the direction that feels better, at least for a while, and then you can start to work into that direction. Um, so that is one big way that you can help. Really another big way is to just get up and walk around. Getting up and moving around, getting the blood flowing. Not only is it good for your body, like your legs, your back, your neck, your shoulders, it's good for your brain because your brain, a lot of the blood flow actually will start to decrease the longer that you're sitting. So if you get up and move around, a lot of times you'll increase blood flow to the brain, so you'll be thinking better, you'll be more efficient, more effective at your job. And you'll probably be less tired, honestly. So I would say once an hour, get up for a few minutes and just walk around, and that should help with your stiffness. And if you really want to hit this, do both. You're going to walk periodically throughout the day. You're going to get up, you're going to do some shoulder circles. You might just do shoulder blade squeezes like this, squeezing those muscles behind the shoulders. You might do some short arm circles, that type of thing, and moving your neck back and forth like that. So if you do this consistently, it's not like just do it when it hurts. Do it before it becomes a problem. Do it once an hour, something like that. Do it a couple times an hour. Set your alarm if you have to. But that should really help. If it's not, if it helps a little bit, but you continue to have issues, sometimes what you need is a little bit more aggressive treatment, a little bit more aggressive attention to those areas. So sometimes things like massage or dry needling, or doing some strength training for those areas. And those are things that we do in physical therapy. So if you tried these things and you're still having trouble, come find us. Come go find a physical therapist in your area if you're listening to this and you're not in the Lima, Ohio area, and see what they can do to help you. So once again, this is Cameron Dennis. I'm a doctor of physical therapy, and hope this helped. Take care.